Overall, hospitals' organizational structures are similar but have unique characteristics that make them function. I work at Novant Health NHRMC in the smaller orthopedic hospital. The local hospital is a part of a larger hospital system that comprises multiple other healthcare facilities. The Novant Health organization operates with a chain of command that starts with the president/chief executive officer, also known as the CEO. The facility operates with the help of numerous individuals behind the scenes. The BMC Health Research article, Hospital Governance, Accountability, Structure, a Scoping Review, highlights how structures and dimensions of governance in hospitals helps it run smoothly. The article shows how accountability builds character and is beneficial in comparing organizational structure. It all comes down to the organization having clear, defined roles for each aspect of the healthcare system to allow it to perform to the highest quality of healthcare for patients. The president/chief executive officer is Carl Armato. His responsibilities consist of overseeing operations, finances, assist with planning, and ensuring optimal performance. The president of a healthcare organization has a duty to ensure that the entire system is providing patients with high quality care. Mr. Armato is the backbone of resources, care coordination, and leads both the medical and administrative aspects of the system to align with overall goals. Each of these next individuals all have the title of vice president, but each have a clearly defined role. The first one is the chief legal officer. This officer oversees the legal affairs. Their job is to ensure each of the facilities is complying with the laws and regulations. It is key that they assist with the protection of the organization from not only legal but regulatory risks. The Chief Transformation Officer is important when the organization is looking at improving overall performance, the efficiency, and improving patient outcomes. The role of the Chief Medical Officer is unique in that the individual is able to provide clinical leadership while ensuring that the implementation of quality, safe care is being performed. The practice of medicine in the facility must be aligned with the values of the organization and also adhere to regulations, which is what this officer oversees. The financial officer holds a very crucial position. The officer provides the financial strategy, maintains the budget, and allocates resources as appropriate. Financial sustainability is important when allocating resources with the goal of the best patient care. The Chief Operating Officer also has a generalized role. This role includes overseeing daily operations, ensuring optimization, and continuing coordination between all departments with the goal of superior care. The role of the transaction officer is not as common. The officer oversees different department merges, partnerships, and even acquisitions. The business transactions they play a part in are with the goal for the growth and progression of the organization as a whole. To be the head of administration means that they are responsible for ensuring that there are smooth daily operations. The departments they control are like the IT, finances, and human resources. All must operate efficiently so that the organization can continue to achieve success. The Chief Digital and Information Officer in the organization controls the digital footprint. The officer aids in putting forth the successful deliverance of the hospital's data and goals. It helps with achieving business goals by leveraging technology, data, and innovative changes to the digital appearance of the organization. The Chief Nursing and Clinical Operations Officer is a critical role. This individual helps to merge the nursing services and clinical operations together for a smooth running healthcare system. This role is crucial in the delivery of the highest quality of care that is both compliant and efficient. It does not stop with patient care, but extends to budgeting, resources, and staffing. They help work with other officers to implement care that follows the most up-to-date clinical practices and improves patient outcomes. Nurse administrators have a high level of education, which allows them to oversee multiple departments and facilities. They have focused on planning, policy, and budgeting. Their role is less hands-on with patient care and deals with more directorial tasks, while the manager of a specific department is a responsible person and they have the responsibility for a specific unit or department in the hospital. The manager focuses on a smooth running of daily operations, oversees staff, and supports a more direct patient care. And then underneath them is the charge nurse, registered nurse, licensed practical nurse, certified nursing assistant, unit clerk, and care associate. These are the staff that make up the unit or department. They help the department function. These individuals directly report to the nurse manager. They must follow the chain of command when escalating issues. The organizational structure of the hospital and organization overall is vital for clarifying roles and responsibilities. The clear structure allows for improved communication and care coordination, resource allocation, patient safety, quality care, and frames the organization's overall goals. There must be effective and timely patient care across the board when each of these officers plays a part. Next is the communication between the organization as a whole, which is divided into staff communication, the communication of the patient to the provider, and just general communication between all staff members a part of the organization. Communication is imperative to a positive patient experience and improves outcomes. The patient to provider communication is key in the satisfaction with care. The MyChart, text messaging, care companion, devices, interpreter services, and community voice are all ways to communicate with the provider. The MyChart messaging system provides an online portal to send messages to the provider when not in office. The other important communication is between staff, specifically providers and nurses. It must be using secure channels if regarding patient or patient care. The different applications are MyPortal, iConnect, the electronic health record, the Novant Health links, the providers using remote access when not on the facility campus, and face-to-face communication. This communication is probably most important when looking at the safety of patients within the hospital system. This allows for the notification of patient health to be relayed in a real-time manner. As for the organizational communication of important policies and changes within the organization, there is email, digital notification, and the organization's website. There is always room for improvement in communication, but the ability to communicate in a variety of ways is beneficial. Barriers to the communication throughout the hospital include system issues such as staffing shortages, time constraints, and just a fragmentation in care. There are barriers to communication which can include language differences, health illiteracy, emotional distress. In regards to the provider, it can include complex medical jargon, bias, and burnout. The General obstacles can include any of the following, such as noise, limited privacy, limitation in their health records. All of these factors can impede effective interactions among the healthcare system and can potentially lead to medical errors, reduced trust, and worse health outcomes. Next is the models of care. The model of care of the Novant Health NHRMC follows a patient-centered care model. The utmost priority is an individualized treatment plan, interdisciplinary team approach to care, and a large emphasis on safe, quality outcomes for patients. There is technological use and enhanced care, along with the health equity to ensure equal access to health care across the system. The collaboration of the care team helps dive deep into the care of the patient as a whole, rather than just focusing on a single problem. The community outreach section of the care model allows for the hospital system to build rapport and trust within the community that they don't necessarily interact with on a daily basis. This outreach helps to care for individuals who may not have the desire to seek care in a hospital setting. The research and education focus allows the hospital to maintain the safe, quality care by keeping practices up to date with the newest data. This all comes down to the patient, who is the top priority in the care model, and each other part addresses it adds to the priority outcome of the patient. The organizational structure always has room for improvement along with the communications and models of care, but overall Novant has a patient-centered care model that they follow, and it makes a difference in the outcomes of their patients.